Do your legs feel heavy, puffy, or achy by the end of the day? You are not alone. Millions of people around the world experience swollen legs at some point in their lives. It can happen to office workers who sit for hours, to people who spend a lot of time standing, and even to active seniors. Swollen legs are not only uncomfortable, they can also interfere with your daily activities and make simple tasks feel exhausting. But here's the good news. There are simple home remedies that can provide quick relief and help your legs feel lighter and more comfortable. Today, you will learn practical and effective strategies that you can start using right now to reduce swelling, improve circulation, and take care of your legs. Imagine ending your day with legs that feel relaxed instead of heavy. That is exactly what we are going to explore in this video, step by step, with tips you can trust and apply immediately. Hi, I am Dr. Emily Carter, and I am passionate about bringing you practical, science-backed health tips that you can use at home. My goal is to make medical information easy to understand without complicated jargon, so you can make simple changes that improve your health every day. Over the years, I have seen how something as common as leg swelling can affect comfort, mobility, and overall quality of life. Many people assume it is just a minor inconvenience, but persistent swelling can sometimes signal underlying issues that deserve attention. That is why today, we are going to focus on home remedies and strategies that can provide quick relief while supporting long-term leg health. You do not need special equipment or expensive treatments to make a noticeable difference. Simple habits, small adjustments, and a few targeted techniques can help your legs feel lighter and reduce swelling significantly. Stay with me until the end of this video because I will share my top tips that are easy to apply in your daily routine. These are practical steps that you can start implementing today and feel the benefits almost immediately. Do not forget to like this video, share it with friends or family who might be struggling with leg swelling, and subscribe to this channel for more health tips that are both reliable and actionable. By the time we finish, you will have a clear understanding of why your legs swell, what you can do to relieve it at home, and how to prevent it from coming back. This is all about empowering you with knowledge so you can take control of your health. Remember, taking care of your legs is not just about comfort. It is about supporting circulation, reducing strain, and improving overall well-being. So get ready to learn effective strategies that will make a real difference in how your legs feel every single day. Swollen legs, also known as edema, occur when excess fluid builds up in the tissues of the lower limbs. This can cause your ankles, feet, and even calves to appear puffy, feel heavy, or become uncomfortable. Edema can affect anyone, but it is especially common in adults who spend long hours sitting or standing. Pregnant women, older adults, and people with certain medical conditions. Did you know that nearly 1 in 5 adults experience noticeable leg swelling at some point in their lives? It is more common than many people realize. Swelling can be temporary and mild, such as after a long flight, a day at work, or a strenuous exercise session. However, it can also be persistent, indicating issues with circulation, kidney function, heart health, or lymphatic drainage. Understanding why your legs swell is the first step in finding relief. Have you ever noticed your shoes feeling tighter in the evening or your ankles looking puffier than in the morning? These are signs that fluid is accumulating in the lower extremities. Swelling can also be accompanied by discomfort, aching, or a feeling of heaviness. Many people assume that resting or elevating the legs occasionally is enough. But if the swelling occurs frequently, it is important to explore the underlying causes and effective home strategies. In this video, we will break down the reasons legs swell, highlight warning signs that should not be ignored, and provide practical tips to reduce swelling safely and effectively. By understanding the mechanisms behind edema, you can take proactive steps to manage it and improve your daily comfort. You will also learn when it is necessary to seek professional medical advice, so you can ensure that any serious conditions are addressed promptly. Swollen legs are more than just a cosmetic issue. They can impact your mobility, energy levels, and overall well-being. Paying attention to your body and taking simple preventive actions can make a remarkable difference. Imagine ending your day with legs that feel light and comfortable, rather than heavy and tired. That is the goal we will work toward in this video. Knowing the facts about leg swelling allows you to make informed choices and incorporate strategies. into your daily life that support healthy circulation and reduce fluid buildup. Let us start by understanding exactly what swollen legs are. Medically, swelling in the lower limbs is called edema. Edema occurs when fluid accumulates in the tissues, causing the legs, ankles, and feet to appear puffy and feel heavy or tight. This happens because your body is not able to balance fluids properly, allowing them to leak from your blood vessels into the surrounding tissue. Swelling can be mild, where you may only notice a slight puffiness at the end of the day, or more pronounced, where shoes feel tight and movement becomes uncomfortable. It is important to distinguish between temporary swelling and chronic edema. Temporary swelling can happen after sitting for long periods, during pregnancy, or after standing for hours. It usually resolves with rest or by elevating your legs. Chronic swelling, on the other hand, may indicate underlying health issues, such as problems with the heart, kidneys, or liver. Think of your legs like sponges. When fluid builds up, they become heavier and stretched, which can lead to discomfort and reduced mobility. Swelling is not just about how your legs look or feel. Excess fluid in the tissues can affect circulation and put additional pressure on your joints, which is why managing it early is so important. Another way to understand swelling is by noticing patterns. Does it appear more in the evenings than in the mornings? Does it worsen after long periods of sitting or standing? These observations can help identify the type of swelling and its possible causes. While mild, occasional swelling is common, persistent or severe swelling should never be ignored. It is a signal from your body that something may need attention. By understanding what swollen legs are and how they occur, you can take the first steps toward relief and prevention. Throughout this video, we will explore strategies and home remedies that can help manage swelling effectively, reduce discomfort, and improve overall leg health. Knowing the basic mechanism of edema is key to applying these remedies correctly and safely. This foundational understanding will make it easier to recognize warning signs, choose appropriate interventions, and take daily steps that support healthier, lighter legs. Now that we understand what swollen legs are, let us explore the most common causes. Swelling can result from a variety of factors, ranging from simple lifestyle habits to medical conditions that require attention. One of the most frequent causes is prolonged sitting or standing. When you stay in the same position for hours, gravity causes fluid to pool in your lower legs and ankles, leading to puffiness and discomfort. This is why people who work at desks, cash registers, or stand for long periods often notice swelling by the end of the day. Another common cause is poor circulation. If your veins are not efficiently returning blood to your heart, fluid can accumulate in your lower limbs. Conditions like varicose veins can contribute to this problem, making swelling more likely and sometimes painful. High salt intake can also play a significant role. Sodium encourages your body to retain water, which can worsen edema. Reducing processed foods and high-salt meals may help manage fluid retention. Certain medications are known to increase the likelihood of swelling. Common examples include medications for high blood pressure, steroids, and some diabetes treatments. If you notice swelling after starting a new medication, it is important to discuss it with your doctor. Pregnancy is another factor that can lead to swollen legs. As the body produces more blood and fluids to support the growing baby, fluid retention in the feet and ankles is common. Hormonal changes and pressure from the uterus can also contribute to swelling during pregnancy. Chronic health conditions are a more serious cause of edema. Heart failure, kidney disease, and liver disorders can all lead to persistent swelling in the legs. In these cases, the swelling is often accompanied by other symptoms, such as shortness of breath, fatigue, or abdominal bloating. Recognizing these warning signs is critical for timely medical evaluation. Lifestyle factors such as obesity or a sedentary routine can also increase the risk of leg swelling. Carrying extra weight puts additional pressure on veins and lymphatic vessels, making fluid retention more likely. Lack of regular exercise can reduce circulation efficiency, which can also lead to swelling. Even environmental factors can play a role. Hot weather can cause blood vessels to expand, making fluid accumulation in the lower limbs more noticeable. On the other hand, cold temperatures generally reduce swelling, which is why some people notice seasonal variations in their leg swelling. It is important to remember that swelling may have more than one cause at a time. For instance, someone who is pregnant, eats a high-sodium diet, and stands all day may experience more pronounced leg swelling than someone affected by only one of these factors. Understanding the root causes helps determine which home remedies and preventive strategies will be most effective. By addressing the factors that contribute to fluid accumulation, you can reduce discomfort, improve circulation, and prevent swelling from becoming a chronic issue. In the next sections, we will discuss symptoms and warning signs that should never be ignored, so you can take action early and protect your overall health. Understanding the symptoms and warning signs of swollen legs is crucial for managing your health effectively. Mild swelling may only cause a feeling of heaviness or slight puffiness at the end of the day. You might notice that your shoes feel tighter than usual, or that your socks leave marks on your ankles. These signs are often temporary and may improve with rest or leg elevation. However, there are warning signs that indicate you should take swelling more seriously. Painful swelling, redness, warmth, or tenderness in the legs could be signs of an underlying issue, such as an infection or blood clot. Blood clots, also known as deep vein thrombosis, are particularly serious and require immediate medical attention. If you experience sudden swelling in one leg accompanied by pain or warmth, it is important to seek medical care immediately. Swelling that persists throughout the day or worsens over time is another warning signal. Chronic edema can indicate problems with the heart, kidneys, or liver. In these cases, you may also notice additional symptoms, such as fatigue, shortness of breath, or abdominal bloating. Swelling that occurs only in one leg may suggest localized issues, such as a blood clot or an injury, while swelling in both legs is often related to systemic factors, like fluid retention from heart or kidney conditions. It is also important to be aware of swelling patterns. Do your legs swell more in the evenings or after long periods of standing or sitting? Do you notice it improving after sleep or leg elevation? Paying attention to these details can help you and your healthcare provider determine the cause of the swelling. Other subtle signs may include changes in skin texture, such as shiny or stretched skin, or difficulty moving your joints due to tightness from fluid accumulation. Ignoring these symptoms can lead to complications and make the swelling harder to manage over time. By recognizing the difference between normal, temporary swelling and concerning symptoms, you can take timely action and use home remedies effectively. Always remember that persistent or severe swelling is not something to dismiss. Understanding your body, observing changes, and responding promptly can help prevent more serious health issues and improve your overall quality of life. In the next section, we will discuss how doctors diagnose leg swelling, so you can understand the medical perspective and know when it is important to seek professional care. Now, let us talk about how doctors diagnose leg swelling and determine its underlying cause. When you visit a healthcare professional with swollen legs, the first step is usually a detailed medical history. Your doctor will ask about when the swelling started, whether it occurs in one leg or both, and if there are other symptoms such as pain, shortness of breath, or fatigue. They will also review your medications, lifestyle habits, and any chronic health conditions. A physical examination follows, where the doctor checks the legs for puffiness, skin changes, tenderness, and temperature differences. They may press on the swollen area to see if it leaves an indentation, a test called pitting edema. In addition to the physical exam, doctors often order laboratory tests to evaluate kidney, liver, and heart function. Blood tests can help detect underlying conditions that may be causing fluid retention, such as heart failure or kidney disease. In some cases, imaging studies may be necessary. Ultrasound is commonly used to check for blood clots in the veins, while other imaging techniques can assess circulation or identify structural issues contributing to swelling. Electrocardiograms or echocardiograms may be recommended if heart problems are suspected. Doctors also consider factors such as age, weight, and activity level when determining the cause of swelling. Understanding these details allows them to distinguish between harmless temporary swelling and more serious medical conditions. It is important to remember that self-diagnosis can be risky. While home remedies can provide relief, persistent or severe swelling should always be evaluated by a healthcare professional to rule out serious conditions. Your doctor may also provide guidance on lifestyle modifications, medications, or compression therapy based on the specific cause. In some cases, early intervention can prevent complications and improve overall leg health. By knowing what to expect during a medical evaluation, you can feel more confident when seeking help and better understand the recommendations provided. This knowledge also helps you recognize when home remedies are appropriate and when it is necessary to seek professional care. In the next section, we will explore general treatment and management strategies that are safe and effective, so you can begin taking steps toward reducing leg swelling and improving comfort on a daily basis. Once the cause of leg swelling has been identified, or even while awaiting medical evaluation, there are general strategies that can help manage and reduce edema safely. One of the simplest and most effective methods is elevating the legs. Raising your legs above heart level for several minutes, 2 to 3 times a day, can help fluid drain from the lower extremities and reduce puffiness. Gentle movement and exercise are also key. Activities such as walking, ankle rotations, or light stretching promote circulation and prevent fluid from pooling in the legs. Maintaining a healthy diet can support this process as well. Reducing salt intake is particularly important, as excess sodium can cause the body to retain water. Eating a balanced diet with plenty of fruits, vegetables, and adequate hydration can help manage fluid balance naturally. Compression stockings or socks can provide additional support. These garments apply gentle pressure to the legs, assisting the veins in returning blood to the heart and reducing swelling. It is important to choose the correct size and compression level, and your doctor can guide you in selecting the most appropriate option. Staying active throughout the day is another simple yet powerful strategy. Avoid sitting or standing for extended periods without moving. Taking short breaks to walk or perform light stretches can make a noticeable difference. Avoiding tight clothing around the legs, knees, or ankles is also beneficial, as constrictive clothing can restrict circulation and worsen swelling. For individuals experiencing swelling due to medication or chronic health conditions, following your doctor's recommendations and reporting changes promptly is essential. While these strategies are effective for general management, it is important to remember that they are not a substitute for medical treatment when necessary. Monitoring the severity, duration, and patterns of swelling allows you to apply home strategies safely and know when to seek professional help. Simple measures such as elevating the legs, staying active, and maintaining a healthy lifestyle can significantly improve comfort and reduce swelling in most cases. Combining these methods consistently can help prevent swelling from becoming a daily problem and enhance overall leg health. By incorporating these general treatment approaches into your routine, you are taking active steps to support circulation, reduce fluid retention, and improve your overall well-being. Now, let us focus on the best tips and preventive strategies to keep your legs healthy and reduce swelling on a daily basis. One of the most effective approaches is to make leg elevation a regular habit. Whenever possible, elevate your legs above heart level for 10 to 15 minutes, especially after long periods of standing or sitting. This simple action helps fluid return to the upper body and prevents it from pooling in your lower extremities. Incorporating gentle exercises into your daily routine is equally important. Walking, cycling, ankle rotations, and calf stretches improve circulation and strengthen the muscles that support fluid movement. Even short, frequent breaks to move your legs can make a significant difference. Hydration is another key factor. Drinking enough water helps your body maintain proper fluid balance and reduces the tendency to retain water. Pair this with a diet rich in fruits, vegetables, and whole foods, while minimizing excessive salt intake. Compression garments, such as socks or stockings, are highly effective for individuals prone to swelling. Wearing them during the day provides consistent support to the veins and encourages proper blood flow. Make sure they fit correctly and consult your healthcare provider if you are unsure which compression level is suitable. Avoid sitting or standing in the same position for long periods without moving. Try to shift positions, stretch, or take a short walk every hour. Also, be mindful of clothing and footwear. Avoid tight shoes or bands around your legs that could restrict circulation. Comfortable, well-fitting footwear and loose clothing can reduce pressure and help prevent swelling. Massage is another helpful technique. Gentle massage of the legs and feet encourages fluid movement and can provide immediate relief. Be careful to use upward motions toward the heart and avoid applying excessive pressure. Cold compresses or contrast baths, alternating warm and cool water, can also relieve discomfort and improve circulation. Finally, monitor your legs regularly. Observe any changes in swelling patterns, skin texture, or discomfort. Keeping a simple log can help you identify triggers and evaluate the effectiveness of your prevention strategies. By incorporating these tips consistently into your daily routine, You can significantly reduce leg swelling, improve comfort, and support overall leg health. Prevention is always easier and more effective than treating severe swelling after it occurs. And these small practical steps make a noticeable difference in everyday life. In this section, we will take a closer look at some common myths and truths about swollen legs, as well as answer frequently asked questions that people often search for online. First, let us address a widespread misconception. Some people believe that drinking less water will reduce swelling. In reality, staying hydrated is essential for proper fluid balance. When the body is dehydrated, it actually holds on to more water, which can worsen swelling. Another common myth is that only older adults experience leg swelling. While it is true that aging can increase the risk due to reduced circulation and other health factors, people of all ages can experience swelling from prolonged sitting, standing, pregnancy, or certain medications. Some believe that swelling is always caused by serious health problems. While persistent or severe swelling can indicate underlying medical conditions, mild and occasional swelling is often related to lifestyle factors and can be managed effectively at home. Now let us answer some frequently asked questions. One common question is why legs swell more during the summer. Hot temperatures cause blood vessels to expand, which can increase fluid accumulation in the lower extremities. Another question is whether weight loss can help reduce leg swelling. Losing excess weight can reduce pressure on veins and improve circulation, which may decrease swelling over time. People also ask about foods that may worsen edema. High sodium foods, processed snacks, and excessive sugar can contribute to fluid retention. On the other hand, foods rich in potassium, such as bananas, oranges, and leafy greens, may help maintain proper fluid balance. Many wonder if swelling in one leg is more serious than swelling in both legs. Swelling in only one leg can indicate localized issues such as a blood clot or injury, while swelling in both legs often points to systemic factors like fluid retention from heart or kidney conditions. Another frequent question is whether compression socks are effective. When used correctly, compression garments provide gentle pressure that helps veins return blood to the heart and reduces fluid buildup, making them highly effective for both prevention and relief. Finally, people often ask how quickly they can see results from home remedies. While some strategies like leg elevation or gentle massage can provide immediate relief, consistent daily habits such as exercise, proper hydration, and dietary adjustments are key for long-term improvement. Understanding the myths and facts about leg swelling empowers you to make better choices for your health. By addressing common misconceptions and answering real questions, you can apply the most effective strategies safely and confidently. These insights help you not only relieve swelling but also prevent it from returning, supporting overall leg health and comfort. As we come to the end of this video, let us recap the most important points about swollen legs and how to manage them effectively. First, understanding the causes of leg swelling is essential. Whether it is due to prolonged sitting, standing, high salt intake, pregnancy, medications, or underlying health conditions, recognizing the reason behind edema allows you to take the most appropriate steps for relief. Second, we explored the most effective home remedies and strategies for quick relief. Elevating your legs, gentle exercise, hydration, a balanced diet, compression garments, and massage are all practical tools that can make a noticeable difference in comfort and reduce puffiness. Third, prevention is key. Incorporating daily habits such as moving regularly, monitoring your diet, wearing supportive clothing and shoes, and observing changes in your legs helps maintain long-term leg health and prevents swelling from becoming a chronic problem. Remember, swollen legs are more than a cosmetic issue. They can affect circulation, mobility, and overall well-being. By applying these tips consistently, you can feel lighter, more comfortable, and more confident in your daily life. We also discussed common myths and answered frequently asked questions, giving you a clearer understanding of what works and what does not when it comes to managing edema. Being informed empowers you to make safe and effective choices at home, while recognizing when professional medical advice is necessary. The strategies we covered are practical, easy to implement, and backed by science, ensuring that you can start improving your leg health immediately. Keep in mind that consistency is the key to success. Quick relief is possible, but long-term results require daily attention and mindful habits. As you put these tips into practice, notice the difference in your legs and overall comfort. By understanding the causes, using proven home remedies, and adopting preventive strategies, you are taking control of your leg health and improving your quality of life. These steps are simple, actionable, and highly effective when applied regularly. Now you have a clear roadmap to reduce swelling, support circulation, and prevent discomfort. Remember the promise we made at the beginning? By the end of this video, you now have the knowledge and tools to take care of your legs, feel lighter, and live more comfortably every day. Thank you so much for staying with me until the end of this video. I hope you now have a better understanding of swollen legs, the causes behind them, and the practical steps you can take at home to find relief and prevent swelling from returning. If you found this video helpful, please give it a thumbs up. Share it with friends or family who may benefit from these tips. And make sure to subscribe to this channel for more science-backed health advice that you can trust. I also invite you to leave a comment below. Share your experiences with leg swelling, ask questions, or suggest topics you would like me to cover in future videos. I make it a point to greet new subscribers and highlight the most thoughtful comments in upcoming videos. Your interaction helps me create content that is relevant and useful to you. Remember, this content is for educational purposes only and does not replace professional medical advice. Engaging with this community allows us to learn from each other and find solutions together. By sharing your questions, tips, and feedback, you are helping others who face similar challenges. I encourage you to participate actively and make the most of the information shared here. Finally, check out the next recommended video on this channel for more strategies to support circulation, improve comfort, and maintain healthy legs. By combining knowledge, practical tips, and consistent habits, you can make a real difference in your daily life. Thank you again for watching, for being part of this community, and for taking an active role in your health. Your legs will thank you for the care and attention you invest in them, and you will feel the benefits in your mobility, comfort, and overall well-being. Remember to comment, like, share, and subscribe, and I look forward to reading your thoughts and questions in the comments section. Together, we can create a healthier, more informed community focused on practical, science-backed health advice.